Avita is used to treat acne. It may decrease the number and severity of acne pimples and promote quick healing of pimples that do develop. Tretinoin belongs to a class of medications called retinoids. It works by affecting the growth of skin cells. Indications. Avita gel is indicated for topical application in the treatment of acne vulgaris. The safety and efficacy of this product in the treatment of other disorders has not been established. How to use. Wash your hands before applying this medication. Gently clean the affected skin with a mild or soapy cleanser and pat dry. Use your fingertips to apply a small amount of medication, about the size of a pear, in a thin layer, usually once daily at bedtime or as directed by a doctor. A gauze pad or cotton swab can be used to apply the liquid. For some preparations, you should wait 20 to 30 minutes after cleansing your face before applying this medication. Consult the label directions, the patient information leaflet, or your pharmacist if you have any questions. Use this medication on the skin only. Do not apply to the inner lip area or inside the nose, mouth. Do not apply to cut, scraped, sunburned, or eczema-affected skin. Avoid getting this medication in your eyes. If this medication gets into your eyes, flush with large amounts of water. Call a doctor if eye irritation develops. Wash your hands after using this medication to avoid accidentally getting it in your eyes. During the first few weeks of using tretinoin, your acne might appear worse because this medication is working on pimples forming inside the skin. It may take up to 8 to 12 weeks to notice results from this medication. Use it regularly in order to get the most benefit from it. To help you remember, use it at the same time each day. Do not use a large amount or use it more frequently than recommended. Your skin will not improve any faster and it will increase the risk of developing redness, peeling, and pain. This medication is available in different strengths and forms, such as gel, cream, solution. The best type of medication for you to use will depend on the condition of your skin and your response to therapy. Tell a doctor if your condition lasts or gets worse. Contraindications. This product should not be used if there is hypersensitivity to any of the ingredients. Precautions. Avoid getting this medication in your eyes, mouth, vagina, or in the creases of your nose. Avoid exposure to sunlight or tanning beds. Avita can make you sunburn more easily. Avoid using skin products that can cause irritations, such as harsh soaps, shampoos, hair coloring or permanent chemicals, hair removers or waxes, or skin products with alcohol, spices, astringents, or lime. Avoid using other medications on the areas you treat with Avita, unless your doctor tells you to. Avita side effects. Get emergency medical help if you have signs of an allergic reaction, hives, difficult breathing, swelling of your face, lips, tongue, or throat. Avita may cause serious side effects. Call a doctor at once if you have severe burning, stinging, or irritation of treated skin, severe skin dryness, or severe redness, swelling, blistering, peeling, or crusting. Your skin may be more sensitive to weather extremities such as cold and wind while using Avita. Common side effects of Avita may include skin pain, redness, burning, itching, or irritation, sore throat, mild warmth or stinging where the medication was applied, or changes in color of treated skin.